A recorder joined.
It looks like we are officially recording now.
Brian.
Joined.
Amy Rob.
Joined.
Jim Davis.
Joined.
Monica, at the beginning of this, would it be okay if we asked for a verbal roll call?
Reverend Durham will be doing that.
True. Okay.
Yeah, we've
Joined.
done a verbal roll call.
Okay.
I believe Reverend Durham will be going through a verbal roll call and then just some etiquette as we go through our virtual board meeting today.
Okay.
Mike Kennedy.
Joined.
Hey, Monica, this is Joyce. Just a quick question. We were supposed to have a real meeting tomorrow. Is that still on, or not a real meeting, but a call or something?
I think that was scheduled for Wednesday morning, not Tuesday.
Right, this is, I'm sorry.
Joined.
Yeah, Joyce, I have on my calendar for 10:30 for a phone call.
Okay, you're going to call me?
Yes.
Okay, great, thank you.
Ben Brooks.
Joined.
Aloysia Mitchell.
Joined.
Amy, this is Ben. Are you there?
Yeah, I'm here.
Rachel Relaford texted me. She's
Leslie
in
McKnight.
Joined.
She said what?
She's in executive session for the county, and she said that she couldn't leave executive session, so just to let you know.
Okay, thank you.
Reverend Duran, this is Monica. It's 6 o'clock. We can get started here. I would just want to make two comments before I turn it over to you, and one is any of the Peoria City County Health Department staff, please email Amy your attendance, as well as we do have two media on the call. They're in listen-only mode.
All right, thank you so much, Monica, for that. We'd like to call this meeting to order with a suspension. I need a motion to suspending of bylaws for our former meeting done so we could do this virtual meeting.
Reverend Duran, you're going to need to do roll call first.
Okay. My apologies. All right, we'll do a roll call first. And so you can simply just say present as I go through the name. All right, Dr. Armour.
Present.
Rachel Relaford. Dr. Agarwal.
Present.
Ben Brewer.
David Trachtenbach.
Joined.
All right. Dr. David Trachtenbach.
Correct.
Dr. Davis.
Present.
Joyce Harant.
Present.
Mike Kennedy.
Present.
Aloysia Mitchell.
Present.
Dr. Nala. All right. We do have a quorum. And so with that, with us not having our regular scheduled meeting in the boardroom, we need a motion to suspension of the bylaws. May I have a motion?
I'll make that motion, Ben Brewer, for
Join.
suspension of the bylaws.
All right.
Second.
Fran Armour, second.
All right, thank you,
Fran
Dr.
Armour, second.
Thank you, Dr. Armour. Thank you so much. I forgot to mention. So please, in the motion, say your name. In the motion that I can document, and we can probably get that on the record. Thank you so much, Ben and Dr. Armour, for doing that. All right. All those in favor, send by saying aye.
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 Aye. All right. Is there a nay? All right. So move. Ayes have it. All right. And so we're going to go now and do our pledge of allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Awesome. Thank you all so much. So again, I just want to interact as we get to our agenda. I'm sorry, public comments. Is there any public comments?
Reverend Duran, this is Monica. We had no public comments submitted by noon today for review.
All right. Thank you.
I would just want to add one more thing for housekeeping at this time. If anyone joins or signs off, please acknowledge your name so that we can put it in the minutes that you have joined the call or that you are leaving the call.
And I'll add on, please say your first and last name just to make sure we have that correct. And continue on with that, I'm going to ask for you all to keep their phones on mute. And if they're going to talk, it's all right to speak. But yeah, just keep it on mute for the time being to remove feedback. When you do enter in on a motion, please state your first and your last name so we can properly mark into it. But if any comments, if you could just still to state your name, that we can recognize who is talking in any comments or during discussion. And you can just direct all questions to me, and I'll try to moderate so we can make sure we get everybody. Don't get too much cross talking going along in the process. Okay. All right. So appreciate everybody getting in on time, that we could start the meeting on time. Thank you for you guys' correspondences and the emails during this time frame of COVID-19. I also want to take this time to acknowledge the great work and the leadership of our Peoria County Health Board, how they've been truly great, definitely in the conferences that Monica's been leading daily there, working with our county and our city during this time. Thank you for their preparedness and definitely the long hours and work many of them are doing to just help keep our community safe. And then also the new information now with the website documenting many of the concerns people have as far as demographics and things, and are being properly recorded with our health department. So I just want to thank you for our leadership. And Monica will share some other great things that they did. I want to steal that thunder too. That's we work with the city and our fighting and our prevention for the COVID-19 case. So I just want to put that on record as we get into that. So moving on to consent agenda items. And so I will entertain a motion for that, please.
This is Joyce Herons. I will move adoption of the consent agenda.
Thank you, Joyce. Is there a second?
David
I'll second that.
Second.
I'm sorry, both talked at the same time. I didn't get who said what. Is there a second?
I'll make it a second, Jim Davis, so we get through this. Yeah.
Thank you, sir. All right. All those in favor, send by saying aye.
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 Thank you. Any opposed? All right, so moved. Thank you. All right. Continue on our agenda then. For our financial report, I will turn to Brian and leaders in that on agenda number 7 for year 2019, for year 2020 financial report summaries.
Can you hear me?
Yes.
Yes.
All right.
Yes.
All right. So there's a lot of numbers in here. So basically, I'm just going to kind of highlight where we ended 2019 and where we were at the end of March 2020. So if you look on pages in your packet 15 and 16 is the financial report summary from 2019. So total revenues for the year ended up being $6,516,810. Expenses ended up totaling $6,130,408. That left us with a surplus of $386,402, and our final reserve balance just above $3 million at $3,002,623. There's a variance report. I know it's later on in the packet, but it explains by line item kind of what the reason was for each line item compared to the original budget, and that's on pages 20 and 20 through 23. So that's revenues and expenses. Is there any questions on 2019? We do have a receivable still of about $150,000, and that's mostly from the state. It's basically 3 grants that we're still waiting to get paid on.
Thank you, Brian, for that. And so with that, just to clarify, you covered agenda items 7 and 8, correct?
I can touch on where we were at end of March here. That was just 2019.
Okay. So for your 2020. All right.
Yeah, this will be quick. Pages 17 and 18 just shows where we were at through March. Revenues, $879,609. Expenses, $1,190,276. So we have a deficit right now of $310,667. But I just looked at some of our larger grants for revenue, and there's about $226,000 that's not reflected in the reports you're seeing on the revenue side. So it's better than it looks for 2020.
And I'll add that we will talk about what the COVID response has done to our budget later on in the agenda.
Okay.
Is there any questions?
Brian, this is Mike Kennedy. My only question is, when you're talking about it, is it that we haven't received funds that we have earned, or we have not earned funds?
They are earned. We've submitted a bill. We're just waiting to be paid.
Okay, that's cool. Thank you.
That $150,000 is reflected in the numbers as revenue. We just haven't received it yet. So hoping within the month or so that it should come through.
Okay.
Thank you. Any other further questions?
Thank you.
Thank you, Brian, for that great report and your diligence in this. And so, yes, we're moving towards on old business, the COVID-19 response, and this is again this information. And go ahead, Monica, please.
So I wanted to touch base on just generally what the health department's role has been in this response, and kind of what we're moving towards, as well as a little bit mentioned earlier, what does that mean for our budget in terms of how our response has affected our kind of financial state. So in terms of our response, I think now I've lost track, but March 2nd, we started our response planning here at Peoria, both the city and the county. Our Emergency Operations Center opened on that Wednesday, and we've been operational 24/7 since. Additionally, a lot of it was getting for contact tracing and investigation work, which still is going on. But we've now moved into, say, the next of our response, which is still monitoring the situation, but also looking at what the next steps are going to be. That includes Jason's work in terms of leading our Emergency Operations Center, as well as resource management, not only for our first responders and our healthcare systems, but even some of our other entities, to making sure that we're working with 211 to access donations and coordinate. I know I've shared in the past the Board of Health, but our Emergency Operations Center includes both the city and the county. It has a policy group that works directly with legislation when there are needs arise and how to advocate for that at the state and federal level. In terms of our sections, we have operations and planning combined. I myself am actually the operations and planning section chief, and underneath that, our branches include public safety, human services, which is a lot of the social service networks we have, including our housing operations, as well as youth services, elderly, and functional needs and mental health. And then we also have healthcare systems, which includes public health and our hospital systems and EMS providers. The other two sections that are in play are logistics, which we've been working with actually a private entity to create a resource system that started here in Peoria, but now looks like it'll be expanding to our tri-county partners, as well as to maybe some of our state partners. And then in communications sit on that group as well. And then the last group being the finance and reimbursement, which our own Brian Gully is assisting and taking a lead for the county to assist with the reimbursements to FEMA. So all of these have been operational now since really after the first 2 weeks. A lot of community partners have stepped in and filled in just wonderful roles and have been making sure that this is very much a community-wide response. And so I think in terms of Peoria's response, we are very fortunate to have really good community partners that we've worked with over the years that respect the work of the health department and recognize us as that trusted leader and have really helped us fulfill our requirements here. And right now, our local health department's major response efforts is going to be contact tracing investigation. That falls squarely in the role of our epidemiology and clinical services group, led by Katie Endress. And we've been fortunate to have staff from environmental health assist in investigation work as well. And so overall, they are working really 24/7 in getting those positive test results, identifying them, working on the contact tracing, really doing the hard work to try to control it as fast.
Dalton Kemper, WNDD Radio.
Joined.
And so very excited, and I think we just have very, very proud of the work of our health department has been doing, and so want to make sure I give the kudos to them. The next phase of this is really increased testing. So it was announced last week, and it was a very quick turnaround, but Heartland Health Services will be doing testing at 3 different sites of the community. One of them that starts tomorrow is East Bluff, or their Wisconsin site. That will primarily be a Monday through Friday site, as well as Saturdays. The other site that will go live on the 27th is going to be their, I think it's actually going to be with the Park District, but their Gwen on the south side, Gwen side, that clinic. The health department will only be a weekend site, and that will be Saturdays and Sundays only from 10 until 2. Our reasoning to make sure that we're a weekend site, well, first of all, we're as a Heartland clinic, we're located in a zip code that helps serve a large population. We're on a great transportation line. We're really focused on doing it on the weekends, just understanding that as this continues and testing is still going to be imperative, as we kind of expand or open up, one of the questions that's going to happen is making sure that our flow with our clients works and makes sense. And so we are going to be primarily a weekend site for Heartland. And during the weekdays, we'll just have our routine services as this moves forward. I would say that our staff will not be directly involved, specifically our nursing, in doing any of the testing, and that's because our nursing staff is pulled into disease investigation work. So they're still very much focused on that public health mission, and so Heartland recognizes that, and so their nursing staff will be the ones that primarily do the testing. I believe they're also looking for volunteers and working with the medical school to assist with their clinics. So in all honesty, we are helping coordinate and pushing out public information, which Diana Scott has been leading for this entire effort and has done just a fantastic job. And so we're really playing more of a capacity role, not necessarily doing the direct service or client-based interventions. So that our Heartland site opens up this Saturday, and I think tomorrow we're going to do kind of a walkthrough of the East Bluff to see and how we can mimic that here on site for the weekend. The last thing I wanted to touch base on is in terms of our budget, how has this impacted us? I know the city has already had their large discussion about their impacts on their budget. The county has spoken briefly about it. Working with Brian, you can see from previously in the packet, under the FY 2020 statement, that we had budgeted for revenues for 2020 to be just over $6.6 million. Recognizing the fact that many of our programs are not, especially those that are public aid, fee-for-service programs, are really running without any touch points, we're estimating about a $290,000 change in our revenues. That would bring our revised revenue estimate to about 6.3. On the expense side, we had budgeted 6.7. With that, though, there are some funds coming into play from our from grants, as well as allowing some of our grants to expand to let us build COVID response efforts against it, knowing that we're not necessarily doing the work of those grants because of the pandemic. And so that, along with budgeted FTE vacancies, as well as the health insurance that we had spoken about earlier, we're looking at a 2020 revised expense to be about 6.6. So everything said and done, our revised budget based on values from end of March of this year, we're looking at, instead of a deficit of $111,000, we're looking closer to a deficit of $284,000. A lot can still change in the next few month, as well as recognizing additional savings, whether it's some of our vacancies because we're not necessarily interviewing at this time will still be open maybe longer than we expected. But again, we did start our initial discussions just to see where we're going to land this year based on the impact of it. I think we're slightly in a better boat than some of our other local government entities here, and that's because we do get funded to do surveillance work and to do public health preparedness work. So a lot of the activities we do are part of grants that we are funded for, and so there is some benefit in that. However, we do know that overall this is going to have impact on our revenues that we've had budgeted this year. That's really my report for the COVID-19 response. I'm happy to answer any questions.
Monica, this is Dr. Agarwal. It's great to hear that we have 3 testing sites now in Peoria region. So what's the indication or what's the workflow like for the patients who will be getting tested here? And what's the turnaround time for the testing?
That's a great question, Dr. Agarwal. In terms of the workflow here, individuals are going to be in those 4 priority groups. They need to be symptomatic because, again, we want them to have enough of a viral load for the test to come back as valid versus a false positive or false negative. But they are going to be they're going to come through either through a drive-through or walk-in situation. They're going to be they're going to go through an intake process, and then they're going to get a nasal swab. The courier runs it twice a day from that site over to the lab in Pekin, and the turnaround time that we are estimating is 24 hours.
Joined.
One of the good parts about this, because it's local, we'll be able to get that quick turnaround time. Now, if the client is already a Heartland patient, Heartland's going to follow up with them and make sure that they are self-isolating properly, checking with any other comorbidity issues to see if the care changes. In regards to the individuals who are not Heartland patients but might have providers elsewhere, much like the community-based testing over in McLean County, those positive results will come to the local health department, and we'll reach out to them and inform them of their test results. My understanding, though, is Heartland will be trying to put the test results into the electronic health record system, EPIC, so it would also be tagged from the provider standpoint, too.
Thank you, Monica.
This is Joyce. I've got a couple of questions. It's really surrounding the testing. As we expand the testing, what I think I heard you say was that we are not only needing to do contact tracing for those who become testing positive, but making a contact with everybody, actually, even the negative, to make sure that they are doing the correct things in terms of prevention. So my question really is, what capacity of staffing to do that kind of follow-up? Do we have it in place? Will we have to be adding staff to do that on a temporary basis? And also, how many tests need to be done in our area as we move forward to possible reopening, a slow start reopening, to make it possible to reopen? Thank you.
So, Joyce, your first question about staffing. So we follow up with all positives. In terms of negatives, the test results come through from the lab itself to them, and we don't necessarily do any additional outreach than what we already do for the general public in terms of non-pharmaceutical interventions, hand hygiene, social distancing, things of that nature. Our primary focus is going to be on those positives and recognizing the need to follow up. Now, we might follow up with some negatives, especially if they are associated with any existing long-term care or congregate setting follow-up that we would be working on. In terms of our staffing, Right now we have 7 staff that are focused on this work, and it's divided up in twofold. We have our disease specialists that are focused on that initial contact and starting that investigation work with the healthcare providers as well as the patients, as well as following up to see how they're recovered. And then we've been fortunate because our environmental health staff, who's trained in the system that we utilize for monitoring, we have currently 3 of them, one of whom is also a Spanish speaker that's helping with our contact tracing. And they're doing a fantastic job. I think our biggest concern is not necessarily workload. I mean, as more and more cases come online, yes, there are going to be concerns about bringing more and more investigation work, and we've reached out to UIComp and other individuals about utilizing them for some of the investigation work. I think our biggest hurdle is always going to be the fact that, and I believe Katie Endress is on the call, is you get slammed with a lot of cases at once. And so that initial first few hours is imperative for us to make contact and understand their health situation, get that contact tracing started. So, you know, right now we've been very fortunate to maybe have 2 or 3 cases a day, but I think it was either this weekend or the previous weekend where we did get a lot of cases at once. And Katie, I know, is on the call. Katie, do you want to maybe talk a little bit about that?
Sure, just in terms of the little bit of the surge that we saw last weekend in our capacity.
Yeah.
Sure. So yeah, a lot of our confirmed cases were being reported to us in the evening. So I would start the investigation process and make a plan as far as which disease specialist would take on that case. And so as they investigate it, they get a line list of contacts from either that individual or potentially their employer if they work in healthcare, of, you know, the patients or residents if it's a long-term care facility, to be for us to reach out to so we can start that contact investigation process. And so once we have that line list, then we pass that on to the staff from environmental health that are assisting us, and they begin the process of reaching out to each of those contacts. And so we have them kind of on a rotating basis because they do still have responsibilities in environmental health. But when they are there, we have the ability to call in other environmental health. So we have 3 total. So if we get a line list that's more than 5, we decided that was kind of a cutoff where we would call in a second environmental health staff or employee to assist. And then if there's more than 10, we would call in a third. So as we get sort of some cases in those congregate settings, like we saw last weekend, we have an outbreak. We have 3 outbreaks that are ongoing in long-term care facilities in Peoria County. So with that, we will, you know, request additional assistance as needed.
I can't hear. So Joyce, can you hear me?
Yes, we can hear you.
You can go ahead, Joyce. Are you trying to have a follow-up question?
No, I lost. I couldn't hear the call anymore. You're back now. I didn't hear the end of Katie.
Oh, was everyone else able to hear me?
Yes.
Yes.
Oh, that's weird.
So, Joyce, I was just saying, you know, as needed, and when we get those cases from congregate settings, that we do request additional assistance at times from the EH staff that are assisting us so that we can, you know, reach out to all of those individuals in a timely manner to start that process of, you know, active monitoring for symptoms. We do have them check their temperature twice a day, and they complete an online survey daily for that 14-day quarantine period. So if they don't complete that survey, we're able to see that in our RedCap system, and then our EH employee will reach out to them just to follow up and say, hey, how are you feeling? I noticed you didn't complete the survey today. Did you just forget, or, you know, what's going on? So So that allows us to keep track, and so that if anyone does develop symptoms, we're able to implement isolation and provide further recommendations as soon as possible.
Then I think, Joyce, you asked about testing and at what point will we have enough testing to kind of look at those changes. It's a little bit of twofold because, remember, testing is going to be a point-in-time diagnosis of an individual. And so you would get a positive or negative test result based on that point in time. So I was sick on this date. That test is going to be good for that date and that time period. Not necessarily before and after. And so one of the questions that's going to always come up is increased testing for the virus itself, but also then antibody testing for understanding what the immunity level is within our community. And that's still really far out. There are about, I think, 70 entities that claim to have antibody testing. I believe only 4 have FDA emergency use authorization, meaning that they have some validation so that you're not getting false positives and false negatives, which is really important when you're trying to determine community transmission. So, if you are looking to shorten the time span, antibody testing is really important. Having said that, viral testing is going to be also very important in terms of how fast we're able to look at what an individual that presents with symptoms, regardless of the prioritization of long-term care facilities and so forth, is able to then quickly self-isolate or isolate themselves and self-quarantine their contacts to control for the spread. One of the things that I think we are learning, especially from the long-term care facility situation in the Colorado counties, is that, not surprising, there are a lot of individuals that are asymptomatic or have very, very mild symptoms that test positive for it, but are not running the fever, not really running those hallmark symptoms. And so one of the questions, especially in congregate living settings, is the need to do universal testing routinely to kind of monitor those individuals because of the fact that their symptomology is so mild or they're asymptomatic, but yet they do have the virus. So there is no gold number or percentage of change necessarily because it's a point-in-time testing, but overall I would say we very much need more testing in our community. And I think the 3 sites are going to be a great resource. I know OSF and Union Point Health have both expanded their testing, and so overall, just the more we get, the better we have an understanding of what's going on in our community.
Monica, this is Jim Davis. Jim Davis.
Fran Armour, but I can wait till Jim finishes. Go ahead.
Okay, I got a couple questions about the testing. Does somebody just show up at the testing center, like at Heartland or the weekend clinic at the Peoria County Health Department, or do they have to be referred by a healthcare provider to that facility? In other words, if somebody feels sick and they think they got the symptoms, can they just drive over there and show up?
Yes, you can. It's both self-referral as well as healthcare providers can refer individuals to those test sites as well.
Okay, thank you.
Fran Armour here, Monica. Quick question. Has there been, and I just may have missed it, efforts or steps within the data collecting in terms of demographics? We continue to hear the disproportionate amount of African Americans and individuals of color who are testing positive and or dying of COVID-19. Is there a plan to foster increased testing or testing period to address this challenge?
So I think 2 parts to your question. One is about the demographic data that we're collecting. and I would say kudos to Katie and Diana. They worked with our county GIS so that on our website there is a dashboard that gives daily updates and breaks down both testing and confirmed cases by zip code, gender, race, and age ranges so that we can see what the distribution is in our community. And so that's one way that we've been monitoring this. But I think the fact that we had Representative Gordon Booth advocate for increased testing, especially within our FQHCs, is really driven by the data that showed in our large metropolises that you have disproportionate impact of COVID on minority populations, and recognizing how our federally qualified health centers, really serve this high-risk population for COVID. And so getting the testing for Heartland was very much directly impacted. As she spoke on our Friday media briefing to actually further discuss this and, how this kind of rolled out. But that was one of the primary drivers for having our federally qualified health centers be able to test more.
And so how does that trickle down to the layperson? Or do you see it trickling down to the layperson in terms of response?
I do. I think overall when there is testing and it's accessible, more so, I think you're going to see it. One of the things that we saw in McLean County is that community-based drive-in clinic, there's a lot of usage from the community as a whole, and McLean was able to identify a lot of cases within their community. And so I think there is our Joint Information Center, which Diana leads along with the city, the county's a part of it. There's hospitals involved, Heartland's involved, all of it. I say this politely, you can't really go on any of our social media without seeing repostings and shared postings of a lot of our messaging. So it is very much flooded in the community.
Okay. Thank you.
So this is Ramat Nala here. From what you are saying, are we looking at possibility of drive-through testing center at Heartland, or maybe a Dream Center, Salvation Army, the high-risk zip codes? Is that a plan, or even the prison population? Because this is where the high-risk people, especially the minority population, are. Is that the plan?
So, yes and no.
Yeah, as an interject, Dr. Nala joined in and kind of Monica after you gave the locations. Can you give her those locations as well too, and then also respond to her question, please?
Definitely. So, Dr. Nala, the Heartland Health Clinic on East Bluff Health Department and at Gwen Park are all going to have both walk-in and drive-through capacity. Right now, Heartland is actually going out to a lot of our homeless shelters in our community as part of our housing plan and preemptively getting baseline health data for individuals to assess their risk, which includes testing if they're symptomatic or referring them to the housing plan to get them out of that high-risk population of a congregate living setting. And so that's already being done by Heartland, and in fact, that's part of our housing plan that we have. And so I think as testing increases, and one of the goals from the state is to actually do more preemptive testing in certain congregate settings to identify those asymptomatic individuals. But right now, we're focused here on Heartland's already going to the congregate living settings as well as those 3 sites.
So rather than just wait to test people that have symptoms, because we know that many people are asymptomatic carriers, is it possible that they can just go to Dream Center or just have people come and get tested? That way we know and we can separate people accordingly.
I think there is some goals for trying to get more testing for the asymptomatic individuals in those high-risk areas, but still right now, because of not wanting to have false positives or false negatives, the issue is really focusing on individuals that have symptoms.
Okay.
Yeah. And so that's my update for the COVID response. Again, if you want more information, feel free to reach out. We do a daily briefing at 3:30 on Facebook, and my understanding is also posted on various other websites. But I think Diana and the PIOs do a fantastic job organizing that and making sure we have relevant speakers. So that is my update.
This is Ben. I just want to say, Monica, I don't think you give yourself enough credit. I've been watching from afar, and I've heard various people talk in the community, and I'm waiting to hear them bring up the county board chairman or the mayor, and everyone brings up Monica and how great of a job she's doing for the health department. And so I just wanted to say thank you, and that I appreciate you, and that's kind of a good leader, is that you always acknowledge your staff. But, I think the board needs to recognize that you're doing all this work, and I appreciate what you're doing, personally and professionally.
Here, here.
Bravo. I agree.
Thank you.
Thank you. Thank you. I just want to say, though, I have great staff, and I don't think he's on the phone because he also needs mental health days, but Jason Marks has done just a fantastic job in this. And so I would be lost without someone like him in his role, and he has done such a wonderful job on this.
That's good to hear. Yes, thanks to Jason Marks. All right. Well, thank you all. Thanks again, Monica, for sharing. And thank you guys for the great conversation and your contribution, board, on that information, the COVID-19 response. In that, I might have missed it, Monica. Did you share about, is that coming up in new business, about the 4-point Sheraton as well with the COVID-19 response?
It is. It'll be under B for new business.
Okay, gotcha. All right. So, continue on into new business and no further. We have an action item here on the agenda, the 2019 annual report. Action item. Is there a motion?
Dave Trachtenberg, so moved.
All right. Thank you, Dr. Trachtenberg. Is there a second?
Ben Brewer, second.
All right, I got Dr. Aguilar with a second. I think somebody's joining, but I heard that name. All right. All those in favor, send by saying aye.
Aye.
All right. Any nays? Ayes have it. Thank you all so much. And so, I forgot to ask, are you going to lead us through the discussion, or do I have a discussion for the end report?
If there's any questions on the annual report, otherwise,
Okay.
Myself or actually Amy Roberts was helpful in putting it together as well to answer questions.
All right.
Monica, this is Mike Kennedy. Oh.
Go ahead, Mike.
Okay. Just had a question in the one section. It's under communicable disease. There were a number of fields. There's an asterisk and no data. Do you know what that's about?
Yes, actually I do, because we've been talking about it a lot with COVID. If there is a case value under 5 by Illinois Administrative Code, we do not post it because it's considered identifiable.
Okay. Is there, and maybe this thing's already gone to press, is there any notation of why that's that way?
Yeah, it's on the very bottom under the STD clinic.
Okay.
It says it, yeah.
Okay, that's cool. That's cool then. Thank you.
All right, thank you so much. All right. Any other questions? All right, continue on the agenda. We'll go to the information and send back over to Monica on the order of the Public Health Administration for the provision of non-congregate shelters.
Thank you. So this is just really informational for you to understand some of the processes we've had to go through as part of this. So the Illinois Emergency Management Agency, or IEMA, asked for communities to identify a housing plan. And this was actually in March. We went in coordination with the city and the county to build a plan. And part of it, since we were one of the early adopters of this plan that still required FEMA approval, was that we actually had to have an order from the public health administrator or the legal authority for the health department to provide additional expansion of what we would want covered as part of the housing. So initially there was some limitations, and I think part of the limitations was the understanding between Illinois Department of Public Health and the Illinois Emergency Management Agency about how the virus transmits, as well as some of the models out there. But because we were one of the initial ones that pushed it forward, we added certain provisions to it for our non-congregate shelters. So this allows for people to stay in the hotels that were identified. In this case, it's 4 Point, to make sure that they were able to include individuals that needed to self-isolate. So they may be discharged from the hospital to recover or complete their recovery in the hotel rather than the hospital setting. And this is part of this was to help the turnaround in the hospitals, for example. Another one was individuals that needed to self-quarantine but could not self-quarantine or self-isolate in their home setting. And a good example would be individuals living in a shelter. So how this shelter is set up did not have space for them to self-isolate properly. And so then the hotel would have been an option, as well as individuals that needed to maybe self-quarantine. Might be individuals that have pre-existing health conditions but have a loved one that might have been exposed that needed to make sure that they were not sharing the same. A good example we kind of thought about would be someone that's going through chemo and not necessarily able to stay in the same space as a loved one that is out and about more. So again, making sure that they can kind of separate, wanting to protect those vulnerable populations. So along with that, we set up in our Emergency Operations Center, working with Home for All, which is the continuum of care, as a lead, to create our housing plan and walk through this. The way it works is now the county, Peoria County, for both the city and the county, took on the lead and is paying for the hotel rooms that we were assigned, and then we'll be requesting FEMA reimbursements for that space. Heartland stepped up and, as going through these congregate living settings, specifically our shelters, to assess residents on their current health situations, because I think that's one of the big things we're learning from this virus is that we say comorbidities such as diabetes and heart disease and lung health issues, but if you're not diagnosed, you don't think you have a comorbidity. And so individuals that do not have a strong history with their health care provider, don't even have a primary health care provider, don't recognize their risk or know of their risk. And so one of the pushes that Heartland has been doing is creating a baseline health data for people so they can be assessed, and those that are vulnerable can be moved into the situation so that we minimize their risk for not only contracting the virus but also as well as spreading it as part of that. And so we're really excited. 4 Points is a great partner to step up. I think it's admirable when someone can. I think there's a lot of concern, and people might not have the best understanding about how a virus works, but now will be thinking of this hotel in a different way. But in fact, this hotel has taken on a great leadership, and I just applaud them for what they're doing. And so that was one of the kind of housekeeping things I had to do during this emergency declaration, is put out that order. We might be looking to update it specifically to include more healthcare providers and essential workers. But right now, there hasn't been a need for that type of housing plan just yet, and we've been in conversations with the hospital systems and UIComp and Heartland to kind of assess that. So right now, that's a part of the plan too. This only affects our local plan. There is a state housing plan, so for some reason, if our housing plan hits its capacity, then we are able to refer people to the state's housing plan as well. And so that's part of it, but this one is only about for us here in the city and the county of Peoria.
Thank you, Monica, for that. Any questions or comments? Yes.
This is Joyce. Is there that's a very large hotel. Are there just a certain number of rooms that have been allocated? And are they in the same area of the hotel, or how are they? How is it going to function within the hotel?
So there are set rooms, and they are there's I think two kind of towers, is the best way to say, or sides of the 4 points, and they are on both sides of that area. They are within a specific floor plan, and that's partly to assist with security. We don't want people that are not supposed to be in that area, and so we have the city has assisted with helping provide security as well, and then Heartland also doing health assessments on site there too. So it's within very much designated spaces of that hotel.
All right, thank you. Any other questions? Seeing now, that's one other thing too. Just was applauding Monica and the leadership with the COVID-19 response. Where I didn't want to jump ahead in the meeting about just that great work and that leadership that Peoria was a precedent for the state of trying to create that kind of living arrangement to help support those who are definitely in need during this time frame. So once again, thank you, Monica, for your leadership in the process.
This is Joyce again. If I might sort of piggyback on that, I had some interaction with folks, citizens from Bloomington, who were concerned about what was happening in McLean County, and they very much saw what we were doing, what Monica and the whole emergency response team and the staff were doing, and saw that as a great model and took that to McLean County. So I think we're an example for others right in our central Illinois area. And thank you for all that.
Thank you, Joyce.
All right. Well, with nothing else, we're on the end of our agenda. So there's no further new business. As a motion to adjourn.
So moved. Jim Davis.
Joyce Heron, second.
I'll second.
All right.
Ramat.
Okay. And Dr. Nye, I got you down for
Ben
third.
Left.
All right. All those in favor, send by saying aye.
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 Carrie Paneer.
Left.
All right. Thank you all so much.
Thank you.
Bye-bye.
Thank you.
Thank you.
Bye.
Left.
Thank you.
Dr. Agarwal.
Left.
David
Amy, I'm going to
Left.
email you my sheet.
Joyce
to prepare
Heron?
my notes.
Left.
Jim Davis.
Left. Left.
Amy Roberts.
Left.
Alicia Mitchell.
Left.
Sue Bishop.
Left.
Mike Kennedy.
Left.